children's hospice home in the state of Minnesota, and just the third in the entire United States. Crescent Cove, located in Brooklyn Center, is an amazing place that provides respite and hospice care to over 80 kids in 2021, from around the state. Over 70% of these services went to low-income families. Crescent Cove has also brought 17 high-paying skilled jobs to a census tract with nearly 30% poverty rate and AMI of only 45%. I urge you to expand access to this program within the state of Minnesota with proposed Senate file number 3879, and appreciate your time today. I'll take any questions.
Thank you very much for your testimony. I believe Senator Dietzig, did you have a question?
Thank you, Madam Chair. Yes, I have just some general questions, and then I have on page 3.28, do we need to get rid of that person or? On line 3.28.
Ms. Pollard.
Madam Chair, Senator Dietzig, yes, I believe so.
So I'll move an oral amendment to get rid of person or on line 3.28.
That's all right with you. Okay. Senator Dietzig moves an oral amendment. All in favor, please signify by saying aye.
Aye.
Aye. Opposed? All right, the oral amendment is adopted.
Madam Chair, thank you. Thank you for clarifying that and for catching that. That was to be part of the original oral amendment. Before, one of the things I neglected to do is perhaps it would be save us some time if we had Ms. Pollock do a general bill walkthrough. It is, as I said, it's modeled after the federal tax credits, and I think hopefully there we'll just get all of your questions answered in a sequential order. And so, Madam Chair, if we could have Ms. Pollock walk through the bill, again, modeled after the federal credits. But hopefully those questions will be answered. But if you see any other oversights, such as carrying that First Amendment language over, we do want to hear that for sure. And I also want to thank Senator Rest for co-sponsoring as well. But let's get to the bill walkthrough, Madam Chair.
Ms. Pollock.
Madam Chair, Senator Nelson, I'll do kind of a very high-level walkthrough of the bill, and I worked with Mr. Stepanek in drafting the bill, so I may need his help on if there are specific questions. Correct. The credit kind of starts with an entity being certified under the federal CDFI fund. At the point that they are, after the time that they are certified at the federal level, they could be eligible to apply for a state new markets tax credit. $100 million is allocated for greater Minnesota, and $100 million in credits is allocated to the metro area, which are defined in the bill. By tying in the federal qualification criteria, there's a little bit more of an easier application process as far as the proving qualifications and then administration of the program. However, the application would have to be deemed complete by the Department of, by deed, and if upon review the application is not complete, the applicant would have 15 days to cure it, after which time they would be designated as having qualified for the credit. If it's not complete, then they would have to begin the application process again. The credit is allocated or claimed over a 7-year period. So for the first 2 years, the credit is zero. For the following 5 years, it's 10% of the amount of the qualified equity investment each year, so for a total of 50% of the investment. There are disqualifications or clawbacks from the credit, so including if an entity withdraws its investment within that period of time, no longer becomes certified or becomes disqualified at the federal level. Madam Chair and members, I think that's kind of an overview of how the credit works and is structured. If there are other questions, I may be able to answer them, or Mr. Stepanek.
Thank you. Senator Dietzick, did you have any questions after that walkthrough?
Thank you, ma'am. I'm still thinking about that.
Sure.
Thank you.
Any other questions, members, right now? Seeing none, Senator Nelson, any closing comments?
Well, yes, members, again, this is one of the things that we know is so important, which is economic development, and it needs to, sometimes economic development occurs in communities that are already seeing jobs and job growth, and we appreciate that. But it's very important, if we're really serious about talking about equity in this state, and if we're really talking about empowering all Minnesotans, it's critical that we get some of these early investments, these economic opportunities in some of our most distressed economically parts of the state. I believe your packet has a map that shows what those identified census tracts are that would be eligible. And again, this is all based upon the federal new market tax credits. So those census tracts are identified, the eligibility of what those qualified development entities are also qualified at the federal level. And this bill just simply allows Minnesota to build upon that and maximize the value of that federal new markets tax credit, just as many other states have done as well. And as you have seen, just using the federal new markets tax credit that is available in Minnesota, by adding our Minnesota new market tax credit to that, we can double that impact. We can extend that impact. We can, just as other states have as well. And so I would just ask that we will lay this over. I do want to note before we do, there are letters of support from the Minnesota Bankers Association. And I think there's another letter of support in here too. So we want to thank that good support. We'll lay this over for possible inclusion.
Thank you, Senator Nelson. With that, Senate File 3879 is laid over as amended.
Senator Weber, would you like to move your bill, Senate File 3401?
So moved, Madam Chair.
Thank you, Senator Weber. To your bill, excess premium credit creation for health insurers.
Thank you very much. As we all know, Madam Chair and members, when the Affordable Care Act was established, they provided for a federal health insurance marketplace, but gave states the right to create their own, which Minnesota did, and that is now known as MNsure. One of the elements of MNsure is that rates for insurance premiums are determined obviously by age and area. And many of our rural areas have received the disproportionately higher rates as opposed to the metro area. Southeast and southwest Minnesota are two areas that have had significantly higher rates through this particular program. What this bill does is that it offers a non-refundable credit to those who purchase either gold or silver health insurance plan through MNsure that exceed the 120% statewide average premium for those metal level purchased plans for that year. The premiums, of course, vary from year to year. Minnesota has undertaken steps in the private insurance market through reinsurance in order to write some of the premium costs down. But those who purchase this through MNsure, certainly at this point in our rural areas, still have to pay a much higher rate. And so the basics of the proposed credit, that it would equal 100% of the excess premium for a silver plan and 75% for a gold plan. And the maximum credit allowed is $10,000. It also would start to, we go up to incomes of $150,000. You know, I have had families tell me that their health insurance premium costs are in the 30,000 plus range for their health insurance. And I don't care what your income is at that point, that takes a major bite out of a family's budget. And so this bill, and I want to give proper credit, was actually developed by Representative Haley from Red Wing area. And I have agreed to carry it in the Senate because I believe it addresses an issue that is an inequity that is there with the Affordable Care Act for our ratepayers in greater Minnesota. And there is, I would draw your attention to the revenue notes. I don't intend to go through them. The department has given an analysis detail. From reading that, you will find that they've had to make various assumptions. There are certain elements that just aren't quite known. Certainly, I'm not going to speak for the department. They are here, and if you have questions for them, I would encourage you to ask them. With that, Madam Chair, I would just turn, Brian Fries is online to testify, and I would turn the testifier's table over to him at this point.
Thank you,
Mr. Freeze.
Madam Chair.
Introduce yourself for the record, please.
Morning. Thank you all for your time today. My name is Brian Fries, and along with my wife, Sarah, we are raising 3 children in Wabasha, small town in southeast Minnesota. In 2021, we applied but did not qualify for the MNsure tax credits, and our premiums had climbed to over $26,000 a year. Through MNsure, we were able to pay $20,000 per year in premiums. Not the Cadillac of insurance, but better than nothing. Our family deductible was around $14,000 a year. If you add that to our premiums, our total out-of-pocket could reach $34,000 a year, and that's really when the insurance kicked in.
Our 2022 plan, again obtained through MNsure, is about $24,000 per year, and with a family deductible that's over $14,000. That puts our total annual cost of health insurance at nearly $38,000 per year. That's roughly 40% of our gross income. This is catastrophic insurance coverage with Cadillac pricing. It does not cover vision, it's not cover dental. It doesn't really cover us if we're outside of the state of Minnesota either. Even with health insurance, we could be one major illness away from financial devastation. This is not one particular health insurer, it's all of the health insurance companies. We live in rural Minnesota, so our health insurance options are more limited than people who live in the metro. If we all had affordable health insurance, maybe we could save money for our children's college, for our retirement. We can't all work for the government or a huge corporation that offers affordable health insurance. The insurance cost really should be the same for everyone, regardless of their zip code. Thank you.
Thank you for that testimony. Senator Weber, let's see, we'll go to questions after all of your testifiers. Do you have any other testifiers?
Ann Buck is listed from Goodhue. I had checked earlier, I didn't see her online.
Ms. Buck, are you online? We don't have that connection, Senator Weber, but she's welcome to send us her testimony, and we'll be glad to
Certainly.
include that with the record. So before we go to Senator Weber for any further closing comments, I just want to see if there's any questions. Senator Klein.
Thank you, Madam Chair, and thank you, Senator Weber. I really like the idea of the bill. I actually have a question for you, but first for your testifiers, the Fries family, and thank you so much for coming in online and testifying with us today. I just want to know a little bit more about your business. What do you do for a living, and how did you end up in this situation where your premiums, as you said, are 40% of your income? Are you a small business owner, or tell me a little bit more about yourself?
Mr. Freeze.
Thank you, Madam Chair. Yes, I am a small business owner, and my wife is a veterinarian. So we're both free market for health insurance.
Oh, Mr. Freeze, we lost your audio. Could you repeat that, please?
Sure.
Thank you.
I am self-employed. I own my own business, and my wife is a veterinarian. And so, we're not able to get in any of the big group pools to get, we're just on the free market for health insurance.
Yep.
Senator Klein.
Yeah, so thank you very much for the work you're doing and for your wife for being a veterinarian. And I guess the only reason for the question is I don't think this is exclusively a rural issue, actually. I think there are families like the Freezes in District 52 and all across Minnesota, so I'm grateful for the initiative. And then I had a question either for the author or for the department or council. Are these tax credits only available to people who purchase through the exchange, or are they available outside of that?
Senator Weber.
Thank you, Madam Chair and Senator Klein. Basically, the bill outlines talks about excess premium and for those who do not qualify for any type of premium tax credit. And basically it refers to the coverages that are available through the MNsure program. Yeah.
Senator Klein, any further comments? Members, any further comments? Well, Senator Weber, closing comments.
Thank you, Madam Chair. I'll be very honest about it. I'm not sure whether this proposal is ready for prime time, as we like to say around here, or not. But I think what it does is that it highlights an issue and an inequity that exists within the healthcare system. So oftentimes we think that if government has put it forth that there aren't any problems involved with it, that there aren't any inequities involved with it, and quite frankly, that's simply not true. And so I think it's really important to remember, and sometimes people say, well, the rural areas, their access to healthcare is so limited. Yes, it is. However, my existing Senate district covers roughly 100 miles east to west. The new Senate district will be 130 some miles east to west. Almost everyone within that, then my Senate district, current or new, within an hour and a half will have availability with a good ambulance service to emergency care and many times much less time than that. Some say, well, we just need to have more people involved in the MNcare insurance program. And let's never forget that government insurance manages to stay solvent by reducing the payments to the providers. And well over half of the patients in my providers' systems either today qualify for Medicare and or Medicaid. And the reduced rate of reimbursement, if we were to increase that, quite frankly, would force some of them out of business. And so, that is not an option, a viable option, in order to ensure that healthcare remains available. I think that this provides some opportunities for our people who are really getting hit with these high premiums. And with that, Madam Chair, I would thank you for your consideration of this bill.
Thank you, Senator Weber. Senate File 3401 is laid over. Senator Rest has Senate File 3572, and I believe there is a A1 amendment. This is a bill regarding income measure used by education and credit modification. Oh, used by the education credit modification. Senator Rest, would you like to move your bill?
I'm going to comment on it first, if you
Okay.
don't mind.
Senator Rest.
This Senate file does address the education credit that's available for for families with with regard to certain expenses for their children's education. The A1 amendment is not new language, is what I wanted to point out. If you look at the second page of the bill, at the provision that is number 16, there's a paragraph of language there, and the bill eliminates the definition of household income, but we do need to retain the difference in taxable year. And so what the A1 amendment does, it's not adding new language, it's putting language back in that is necessary. So with that, I would move the A1 amendment.
Thank you, Senator Rest. This is author's amendment. All those in favor signify by saying aye. Aye. Opposed? Senator Rest, your bill is amended.
Thank you, Madam Chair. As we know, with the TCJA, we went from using federal taxable income to adjusted gross income to determine tax liability for Minnesota individual taxpayers. What this bill does is make that same change, not taxable income, but make that same change away from household income, which includes all non-taxable income, and starts instead with adjusted gross income. It really amounts to a simplification for the taxpayer. No other changes are in it, and it is relatively inexpensive. If you look at the revenue estimate, it is what? It is less than $1 million in the first year, and a little bit less than that in the succeeding years. I would point out, so it's a very simple, mechanically simple provision to go from household income, and if you're interested in what the definition of household income is, that is provided on that 1R page that is being deleted in this bill. And the governor, I might point out, also has a proposal that moves toward adjusted gross income as the beginning for a calculation for the education credit. This bill makes no other changes. It doesn't change the amount of the credit. It doesn't shift any of the income thresholds at all, which I think also leads to the rather modest, in this day and age, at least this session, modest revenue estimate. The governor's proposal, just to put that out on the table, it increases that threshold for when the phase-out begins to $70,000 from the current $33,000. And it adjusts that threshold annually for inflation. And I would suggest that, I don't have an amendment ready right now, but I would suggest that if we want to pursue an improvement in this education credit, if we adopted the adjusted gross income, but then allowed the threshold to rise according to inflation, I think that would be very, very helpful. And we know that there are other provisions in our tax law that, like our actual taxable income to which the rates are applied, that they are indeed adjusted for inflation. So this bill makes one big change, and that is definition of income, moves from household income, which includes all non-taxable income, there's a long list, and shifts it to adjusted gross income, but makes no other changes. So that's the bill, and do have one testifier.
Thank you, Senator Rest. Welcome to the committee. Please introduce yourself for the record.
Thank you, Chair Nelson and members of the committee. My name is Matt Norris, and I'm the Policy Director and Director of Minnesota After School Advance at Youth Prize. We strongly support the simple but important change proposed by Senate File 3572 and thank Senator Rest for bringing it forward along with Senators Klein and Dietzig. This tax credit helps families pay for after-school activities, computers, school supplies, and musical instruments. I'm sure you've all heard the personal stories from your own districts of the impact that the pandemic has had on Minnesota students. Many of them are a year or more behind in school, and computers are now a ubiquitous part of the learning experience. This means that after-school programs like tutoring and access to computers are not just luxuries anymore, they're necessities. That's why we've seen a 3,400% increase in demand over the past 2 years for our Minnesota After School Advance program, which helps families use this tax credit. We've served families from over 200 Minnesota cities during that time and leveraged this tax credit to pay for over 18,000 hours of tutoring just last year alone. This tax credit is one of the best tools the state has for getting students caught up academically and shifting to using federal adjusted gross income to calculate eligibility rather than the more complex household income definition would make it easier for families to get the assistance their students need. The income limit for the maximum credit, as Senator Rest mentioned, is $33,500 for that maximum credit. From our experience, this means the typical taxpayer using this credit is often a single parent juggling multiple jobs and primarily focused on just a daily struggle to meet their family's basic needs. They often have limited formal education and may not speak English as a first language or at all. They often have little familiarity with taxes and the tax filing system, and they're reliant on others to guide them through the process. Combine those factors together, and navigating the current household income definition is a steep barrier to a parent simply looking to get their student some tutoring or a computer. For example, just one of the items included in this definition is, and I quote, "the amount of a passive activity loss that is not disallowed as a result of Section 469, paragraph I or M of the Internal Revenue Code, and the amount of passive activity loss carryover allowed under Section 469B of the Internal Revenue Code," end quote. With all due respect, I'm guessing many of you, even as members of the tax committee, are sitting here wondering whether you would have anything to report under that item. I know I am, even with a law degree. Now imagine that taxpayer I previously described trying to navigate that same definition. Other elements of the definition lack any logical consistency. For instance, MFIT payments count toward the income limit, but SNAP benefits do not. The result is a daunting maze that we do our best to help families navigate. We currently employ 3 part-time navigators just to help families with this process, and we're in the process of hiring a 4th. This is in addition to a network of community-based organizations around the state that we rely on. In contrast, federal adjusted gross income is a single number that we can point families to on their annual tax return. Over time, the state has been gradually phasing out this household income definition for these types of tax credits. Just a few years ago, the legislature shifted the dependent care credit from household income to AGI, and it's time we make the same change for this tax credit as well. Before I close, I'd like to briefly note that we still believe we also need to update the income limit for this tax credit. It hasn't been changed in 25 years, and we'd like to thank the strong bipartisan group of senators, including Senators Eichhorn, Rest, Nelson, Chamberlain, Klein, and Dietzig, who have all authored or co-authored legislation to that end. We urge you to leverage this bipartisan support, along with support from the House and the Governor's office, to make this the year we finally get that income limit updated. However, today's bill is another important step forward to making this tax credit more fair and accessible for the Minnesota taxpayers that it's intended to serve. Thank you.
Thank you, Mr. Norris. Thank you for your work. Members, any questions or comments? I do thank Youth Prize and all of our, everyone who's so focused on our kids, particularly, and their education. We know education is the great equalizer. And many of us, I think all of us in Minnesota, are gravely concerned about the last 2 years going on. It's not over yet, perhaps, but the last 2 years where our kids have not had the education that they need, and they've not been able to see their teachers. And we are thankful to live in a time of great technological advancement that allows for things like Zoom, things like that, online education, things like Khan Academy. We're really appreciative of those things. We do want to make sure that all parents have access to all the tools today. But knowing that teachers in the classrooms are most important, I would say it's very concerning for the many kids who have not had that opportunity much in the last 2 years, and then not even today in Minneapolis. It's just very, very frustrating. We know that more and more parents are looking, and rightfully so, how can they make sure that their kids are great readers and that their kids get the education that they need. So Senator Rest, I appreciate you bringing the bill. We'll turn it over to you for final comments.
Thank you, Madam Chair. Not to be flippant, but people that receive a lot of passive income aren't going to qualify for this credit to start with. So in terms of their adjusted gross income. But I do think that it's worth a look in any number of instances where we base a benefit on household income, which includes all of that non-taxable income. And that includes Social Security, too. There can be some parents who receive SSI for a disability, but still want to provide for their children, even though they're not receiving Social Security because of their age eligibility. So I do think this is time to make this change for this credit, and that we should continue to look at it for other credits as well, and particularly with regard, quite frankly, to our property tax refunds. But this is a start for this credit. Again, I think that, in addition, at least tying the threshold of the income, if we don't raise it to the level at which the governor has it at 70,000, that we seriously consider indexing it to inflation. But thank you very much for hearing the bill, Madam Chair and colleagues.
Thank you, Senator Rest. Senate File 3572 is laid over as amended. Members, thank you so much for the attention today. We see a lot of good bills in this committee that can really benefit Minnesotans from corner to corner all across this state. Today this meeting is adjourned. Our next hearing is March 22nd.